Afternoon, everybody. I'm Dr. Richard Diabreu-Lorenzo from the Centre for Health Economics Research and Evaluation with the Faculty of Business. I want you all to imagine for a moment that you're sitting in a room like this and you're part of a committee that's making decisions about funding for cancer care. You've got a fairly good idea about the costs of that care and you understand what it does to how long patients live, the cancer, and you've even got a little bit of data about how patients feel in terms of their quality of life. But do you know whether or not those things matter to patients? And what about to taxpayers? And what else might matter to people? Do people care about the type of care that they're receiving or how often they're treated? So some of the research that we've been doing at SHARE, as we like to call it, with women who've been making decisions about how to manage breast cancer risk, has told us that having patients involved in that research and as part of those research teams helps us to answer those questions. But involving patients in research is more than just how we complete surveys. It's more than just getting things through an ethics process, or as somebody said to me last week about getting grant funding. It's about actually having them inculcated in our research teams to help us in guiding the research, importantly interpreting the research. And what that can help us to do is to ensure that we are asking the questions that matter to the people who are using that healthcare. And that we ask those questions in a way that people can understand so that they can provide us with the answers that they think are important. The other thing that patients as a part of our research teams do is to provide us with an understanding that we as non-patients and people who don't have experience of a particular condition wouldn't otherwise have. So it gives us important insights into understanding a condition and how it's treated. And that's critical for what we communicate and the impact that we then have on policymakers, people who care for patients, and importantly, other researchers. So what I'm going to do is to build on that existing work and to take this a little bit further and to look at expanding how we make decisions in cancer care and importantly the role of patients in those decisions. And I'll be looking at things like how a woman might make a decision of whether or not to have her ovaries removed if she's talking about managing ovarian cancer risk, how a man who survived colon cancer might make a decision about whether to stick with his GP or continue seeing his specialist for long-term care, or how the parent of a child with cancer might decide whether or not to treat them at home or in the hospital to manage those ongoing complications of care. And in all of these settings, patients will be part of the research teams to help focus and guide the research and then to interpret our results. So why does all of this matter? Well, it matters because we always see in the media the big bucks that are spent on healthcare, and we know that those dollars are not endless. So we want to make sure that when we're treating people, that we're not only providing care in the right way, but that we're providing care in a way that matters. And patients can help us to do that by having them as part of our research. So I'm very eager and keen to progress this research and to see where we can go in helping governments make better informed decisions. Thank you.